My first job with Lee Memorial Health System was at Southwest Regional Medical Center on the oncology medical floor. I am happy with what I'm doing, so I stayed. I love my job to this day. If I retire, I will miss it. Maria Bell Andress, RN, General Medicine, Gulf Coast Medical Center.
My name is Marilyn Anthony, and I'm an RN, and I've been with Associates in Pediatrics for 35 years, and I've done a little bit of everything there. I think the most rewarding is some of these young moms that you talk to, and you get done talking, and they say, oh, thank you so much for helping me out. You know, I didn't want to call this evening, or I didn't want to do this, but I just didn't know what to do. You know, it's a great feeling to feel like you're being a help to someone.
I've always worked here at Lee Memorial Hospital. I don't think my car would know where to drive any other place. I started out as the receptionist in the president's office. We were in the 8th floor of the patient tower here at Lee Memorial. It was just Sandy Wharton and Mr. Gadd and I. One of the first things she taught me was how to make coffee. And another thing that was one of my duties was I typed the phone directory on an 11 by 17 piece of paper, and then I took it down to the copier and reduced it down to 8.5 by 11 and threw it in everybody's mailbox in the mailroom.
On a typewriter?
On a typewriter. I was one of the, several years later, I was one of the, I think there was about 7 secretaries of us. We got one of the first word processing systems, and it looked like the Starship Enterprise, especially the printer. And we were probably maybe one of the first tweeters, because our email or the messaging was about 120 characters that scrolled across the bottom of the screen. So, and now we're to where, you know, look where we are now.
Kathy Bacon is just a great person, energetic, and a team player. Kathy always stretches her comfort zone to learn new practices. Statement from Annette Forlenza, Director of Surgical Services, Cape Coral Hospital.
Grace under pressure is Dina Brillz' mantra. No matter the challenge or issue, she will face it with a can-do effort, positive attitude, and unrelenting focus. She is a never-ending smile. Statement from Larry Altier, System Director of Food and Nutrition Services.
Sherry Bupp is a loyal employee who strives for excellence. Statement from Annette Forlenza, Director of Surgical Services, Cape Coral Hospital.
It has been a great pleasure working for Lee Memorial Health System for 35 years. It has been a wonderful workplace and a home. Thank you so much for everything. Linda Bush, General Surgery, Gulf Coast Medical Center.
Hello, I'm Vincent Fury, Director of Plant Operations for Lee Memorial Hospital, and I'm speaking on behalf of J.R. Cantrez, who's celebrating 35 years of longevity with the hospital. So J.R. is the textbook definition of service with a smile. He's always got a smile on his face. He's always conscientious about the way he looks. You know, he's the only person I know that could go underneath the building and come out without a speck of dirt on himself. You know, he's just always going around. He's got a big smile on his face. He greets everybody. He's, you know, always happy to be here, and he's kind of made this place his home. He's a selfless, caring, and he's been a mentor to me. He's an asset to the healthcare community. I'm proud to have worked with him, and the pleasure's been all mine.
What I would tell someone who's new at Lee Memorial, a new employee, is to seek out every opportunity to learn, to advance, and do as much as they can. Don't let fear or that they feel they can't do something, but to try it, because Lee Memorial has a lot of opportunities, a lot of positions, a lot of education that they can support you in, and to try your best, just to not be afraid. I was actually born at Lee Memorial Hospital, so I guess I thought, I'm not sure that 35 years when you're young you can think that far ahead, but yes, I'm born here, lived here. I'll probably be here for a lot longer.
Another 35 years.
Another 35 years.
Thayer Colbath is one of the most knowledgeable surgical technicians in the OR. She is willing to share her expertise and always puts the needs of patients first. Statement by Annette Forlenza, Director of Surgical Services, Cape Coral Hospital.
I am the only employee ever to share an ID number. I became 01909A. I'm not sure what became of 01909B. When I retire, and now too, I hope everyone remembers that the third shift are a different breed and often forgotten. But yet I still have so many great memories, too many to list. Dolores Crowl, RN, OB Triage, Health Park Medical Center.
Liz Denny began as an LPN when in the days of Fort Myers Community Hospital. She migrated to the pharmacy where she has been managing quality assurance for the pharmacy department effectively for many years. Her nurse's perspective is extremely valuable to us as we analyze our operations for continual quality improvement. Statement by Pete Duggan, Director of Pharmacy, Gulf Coast Medical Center.
I have to reflect back on a story when I was in PACU at Lee. Jim had just come on board, and it was a weekend, and I was transporting a patient to their room, and Jim came alongside me and said, "Hey, I'll help you push your stretcher to the room," and helped me take the patient to the room. He didn't help me put the patient in bed, but he did get me all the way to the room, and I was pretty impressed with that. I went to work in Kansas City, Missouri, and the day I started, HR told me that, and this was 1967, that my retirement date would be 2011. Now I'm 21 years old, and I thought, 2011, the world won't even be here then. You know how you think? So here we are, and I never thought I would be working this long, doing the things I've done, and still making an impact. It's pretty exciting.
We would rely on our instincts more than on the computers and the machines back then. Sometimes I checked my patient's temperature, and if it was a little off, I'd use my hand on their forehead and call it my mammometer instead of the thermometer because I knew something was wrong. I always like to go by my instincts rather than what the machines would tell me. I know that I've touched the patient maybe more in their heart than anything else. Sometimes my patients tell me that they think that I'm an angel and I made a difference. And that makes me really feel good because it's more than just healing the person, it's healing the heart of the person and making their day a little bit better than they thought it would be.
When I first started, my daughter's in the service and something happened to her, and they were really nice to me. So, hey, we family, so this is the only way I can express it. One of my directors always said to me, look inside a person's heart and not what come out their mouth. So through the years, I have learned to, take that and look at people, have fun, enjoy life. And I really enjoy working there.
Sandy Gloucester is not only dedicated and loyal, she has been in the same department for 35 years. It's amazing to be with the same health system for 35 years, but in the same department? That's almost unheard of. Sandy is amazing. Statement by Jennifer Blue, Nursing Director, Neurological Unit, Gulf Coast Medical Center.
It doesn't matter what department that you work in, what you do, whether it's housekeeping all the way up to Jim Nathan's office, you need to be a caring person, caring for people. It was a lot of fun. We enjoyed it. And even the hanky-panky that was going on, behind the scenes is, it was part of it. I wish that I would have written some notes about what happened back in those days because I probably would have had a bestseller today.
Hi, I'm Vivian Hill. I work in medical ICU at Health Park. I've been at Health Park since just after it was opened. And I was at Lee Memorial downtown prior to that. So I started July 21st, 1980. That's a big part of job satisfaction, I suppose, to feel like you're making a difference. It would be hard to be in a career now that you weren't making a difference every day.
I just want to thank Jim Nathan for having a vision that included Cape Coral Hospital, or we wouldn't be here now. And that was over 2 decades ago. So he took us in when we were at a very delicate spot and fought for us. So thanks, Jim. I don't think there's a secret. I think that we all started out when it was very small and became family, and We just stayed, all of us, and you're working for the best organization around, so why would you go looking anywhere else?
The people I work with. That has to be the most important. And then the people that I take care of. People basically like you because you take good care of them and you listen to them. And that's important. So that, I would say, is probably the two best things about my job. I get to talk to people, which I love to talk. And I love the people I work with. I have not ever worked with a group of people I did not like. Today, coming up, I was thinking, in 10 years, it'll be 45 years, and I'll still be working because I can't retire yet. So you'll see me again. Yes.
Shelly Ireland has been part of our core team for 35 years. She never calls out and takes her work here very seriously. We're lucky to have her. Statement from Pete Duggan, Director of Pharmacy, Gulf Coast Medical Center.
It has been an amazing journey. With all the positive changes, the time went by very quickly. Professional growth and operational changes in the system have made the work enjoyable. Barb Judd, Interim Director for Food and Nutrition Services, Gulf Coast Medical Center.
My name is Mary Kirkwood. I'm System Director, Medical Staff Quality. I've been with Lee Memorial Health System for 35 years and 2 years prior with Cape Coral, so 37 total. It's been a journey. It's been a journey that I've been proud of, the accomplishments, the people that I've met, and the achievements that I've been able to participate in. It's been a journey, a blessed journey.
Of course, we started out with just, Lee Memorial Hospital. And actually, I remember when I started, Jim Nathan was an intern. And then, of course, then we acquired, we built Health Park and then acquired Cape Coral and now Gulf Coast. So the biggest thing, I think, has been the growth. But I still have always felt that there's still a closeness and at each hospital. It's hard to believe, the years go by so fast, and you just don't realize it. But I've always, in your life, you always need something to make you feel like you have a purpose and that you belong somewhere. And I've always felt that when I with Lee Memorial Health System, that I felt that I was valued as an employee.
My name is Randy Petrine. I'm the System Director for Radiology, and I'm speaking on the behalf of Carol Newman, who's been with the system for 35 years. Carol is known in the department by her middle name, which is actually Tina, so most of us call her Tina. Tina says that she loves her job and has always wanted to work in radiology since she was in high school. She says that she sees the radiology staff as her family, since most days she spends more time with them at work than she does at home. We very much appreciate Tina and congratulate her on 35 years of service and dedication to her patients and her work family. Thank you, Tina.
I think probably my most sad experience was the day that we left Southwest and moved to Gulf Coast, because that was my home down here. And my unit was the last unit to leave the hospital, and myself, my clinical supervisor and director, we turned out the lights, said goodbye. It was the moment. It's a happy moment, a lot of memories. Found a new home. And it's a good home. Thank you for having me.
I think I'm proud of the fact that I've been involved in a lot of firsts. I was actually the first radiology nurse that the system ever had, and the position has now grown to the point where we have 25 nurses between the 4 hospitals. The reason I stayed is because I can't think of a reason why I should leave. Lee Memorial offers everything that I'm looking for. It offers stability, it offers a reputation that I'm proud to be associated with, so I don't know why I should leave. That's the way I look at it. There's no motivation for me to leave. When I talk about the reputation of the system, I'm really talking about Jim's reputation. I can't think of anyone that I would rather be associated with as a leader than Jim, and I think he has done phenomenal things for the system. And so again, I'm appreciative. I know that the reason we are where we are today is because of him. So I'm proud to be associated with him.
I was young, I was 20 years old, and I started on a med-surg unit as a licensed practical nurse. And I was excited, and I thought, I'm gonna work on this floor till I retire. My advice to someone who is just starting here is to breathe and take in the atmosphere. Remember that everybody was new at one time.
Denise Pringle is an excellent nurse, and she has great clinical skill. When I think of Denise, the word that comes to mind is patient advocate. She is passionate about her patients, and she truly makes a difference in their care. Statement by Candy DeWitt, RN Associate Director, Surgical and Obstetrical Services.
The people that I work with, they're just like my family. They're all, just like my second family, a family away from home, because they always have been there for me. It's always light working here, and I don't know where else I would want to work, because I started so young and I've always had good experiences, so I love it. It's been great, and it really don't seem like it's been that long. It's just, it don't seem like it's been 35 years. It went by fast.
I'm Sheila Snow Martineau. I have worked for 35 years as a nurse, first starting at Southwest Regional and now Lee Memorial. Liking your job and wanting to keep coming back, and the rewards that you get from it. Your peers, your coworkers, and like I said, the patients rewarding you for what you've done, that you make a difference. Because of the length of time you're around each other and you support each other. So I guess you could be a dysfunctional family, but that's what works. If you're not a part of the family, then you don't last long.
My name is Lynn Gott. I'm the Administrative Lab Director for Cape Coral Hospital, and I'm speaking on behalf of Cheryl Vincegera, one of our medical technologists who has been with Lee Memorial Health System for 35 years. Cheryl is one of the most caring and compassionate people that I think any of us have ever had the pleasure to work with or to know just in general. Cheryl, it has been a wonderful experience working with you. She's going to retire this year. I will miss you a lot. I couldn't ask for a better employee ever. And it has been a wonderful time that I have been your director, and you are going to be a tough act to follow.
Hi, my name is Brad Wickham. I've worked for Lee Memorial for 35 years. I'm the owner's representative, and I oversee the construction of all the outpatient facilities.
What does it mean to be owner's representative?
I'm the ringleader. I'm the ringmaster. If somebody had told me I was going to do this for 35 years, I'd have told them they were out of their mind. I've always thought that I was trying to contribute to something that was in the best interest of the people of Lee County and my family and your family, because that's what it's all about.
I've been with the system almost 30 years, and I've personally worked with Camilla for almost all of those 30 years. Camilla has been an important part of the Lee Memorial family for more than 40 years, and we would like to thank her for her dedicated service and her tenure with Lee Memorial Health System. Thank you very much, Camilla, and we are looking forward to many more. Camilla's a very special person. Sometimes I don't know that she knows how special she is.
I do remember the first week, first few months.
What do you remember about it?
I remember being really scared. I had grown up in Fort Myers, so I was familiar with Lee Memorial, and it really was kind of a scary time, but people were really nice. I've enjoyed my time here. I really have. As I look back, I was doing that over the weekend, kind of thinking about it, and all the people that helped me along the way, and all the people that I hope I've helped along the way. And I'm really satisfied. I'm very satisfied with my years here. Not that it's perfect. It's never always perfect, no matter where you are. But I think they're really good people.
My name is Carla Simpson. I'm the laboratory manager here at Lee Memorial. I'd like to talk a little bit about Carolyn Ireland, who has been also with Lee Memorial Health System for 40 years. Carolyn is a woman of few words, unless of course you ask her about her four-legged children, which is Maddie and Mickey, and then she has all kinds of stories to tell you. Carolyn, thank you for all that you do, and congratulations on your 40 years. And you just make it so much easier for all of us to deal with the information system, and it's a scary world in there in the IT land, so thank you.
Roslyn Kreider has been a loyal and dedicated employee of Lee Memorial Health System for over 40 years. She's always maintained compassion as well as promoting quality care for her patient. Statement by Marguerite Pierce, Nursing Director, PCU and Infusion Center, Lee Memorial Hospital.
I'm Carla Simpson, Laboratory Manager here at Lee Memorial Hospital. I'm talking about Diana Schell, who has been a laboratory technologist for 40 years here at Lee Memorial Hospital. So that kind of sums up Diana in a nutshell. She is very loyal. She's a kind person, very helpful. She's always looking for things to do throughout her day along with her normal work. I think that one of the most unique thing about Diana is her infectious laugh. You know when she's in the house, you can hear it throughout, and it always puts a smile on everybody's face.
Well, I've seen us go from paper to this modern technology, and I've seen leaders go, you know, and new leaders come. I've seen a lot of changes. All of them I can't remember, but a lot of changes. I've seen enough people to come and go to start a small hospital again.
I love that.
So, but I've learned a lot. And when you learn something, no one can ever take it away from you.
I've been with Lee 45 years. Yeah. Honestly, I came here to be a housekeeper. I didn't care if they gave me a job as a housekeeper, if they gave me a job as in the kitchen. All I wanted was a job. But they gave me more. Seriously, they gave me opportunity to learn to be a nurse's aide. And from there, I started as a high school dropout. I have my master's now. I get so emotional about Lee. I did not mean to do this. But the one thing, if I wanted people to remember me, it would always be there, caring, someone that you can trust. Yeah, great integrity. When you have such a role model like Jim, it's easy to love and care and want the best for everybody. Yeah. So I said, Jim, you have been such an inspiration to me and for my family. So I said, thank you, and I have enjoyed and enjoy working for Jim Nathan. I'm proud to say I work for Lee Memorial Hospital. Jim Nathan is my CEO.